Mask all, mask all. Very Eastern, transcendental in orientation, don't you think? Now, faith is the substance of things hoped for, the evidence of things not seen. For by it the elders obtained a good report. Through faith we understand that the worlds were framed by the word of God, so that things which are seen were not made of things which do appear, such as recorded in the New Testament book of Hebrews. And if you describe yourself as a scriptural literalist, perhaps a fundamentalist or recreationist, and you know who you are, then that is simply the way that it is. But even though, according to Pew Research Center, as many as 65% of Americans would have described themselves as Christian before the current public health crisis, with as many as 23 to 25% describing themselves as nuns, even larger than the number of Catholics in America. Then, according to Barna Group, as a result of government mandates, by August 2020, 1 in 5 Christian churches, for over 318,000 total, had closed their doors permanently, never to reopen. Prior to the pandemic, Pew Research Center had reported that religion was in sharp decline, having decreased by 12% in numbers of Americans who would describe themselves as Christian. Christians in Christian churches, for whom the CDC has not yet sent down the final guidance in terms of whether or not it's safe for them to pass around a collection plate. And that does not include church attendance in terms of the decline in the faith amongst Christians. According to Pew Research Center, in October 2019, over the last decade, the share of Americans who say they attend religious services at least once or twice a month dropped by 7 percentage points, while the share who say they attend religious services less often, if at all, has risen by the same degree. In 2009, regular worship attenders, those who attend religious services at least once or twice a month, outnumbered those who attend services only occasionally or not at all by 52 to 47% margin. Today, those figures are reversed. More Americans now say they attend religious services a few times a year or less, 54%, than say they attend at least monthly, 45%. By March, again, according to Pew Research, there was some hope for those in the faith, finding more Americans turning to prayer, as many as 65%, and even finding as many as 24% of atheists seeking answers, resorting to prayer. And researchers, they don't say who they were praying to, but they were praying. And researchers upon whom Virginia Governor Ralph Northam had relied as a data institute for the University of San Francisco had noted that historically epidemics are a time of fear, confusion, and helplessness. And at least according to that research, masking, wearing, and even mask making or distribution can provide feelings of empowerment and self-efficacy. And so, for the next few moments, we shall delve into another question regarding faith in America. Regarding your faith, the research upon which the nation's only physician serving as a state governor had relied upon for facial coverings mandates, which had stated an important benefit of recommending universal mask wearing would be to serve as a visible signal and reminder of the pandemic, as if you needed another reminder of the pandemic. And given the importance of ritual and solidarity in human societies, it is plausible that visible public signaling via mask wearing can potentially increase compliance with other health measures as well, such as keeping distance and hand washing. Health, especially during an epidemic, is a form of public good in that everyone else's health behaviors improve the health odds of everyone else, and that it is non-rivalrous in that one person's health does not diminish the health of anyone else. Visible signals, it continues, play an important role in human societies. As such, signaling participation in health behaviors by wearing a mask, as well as visible enforcement. For example, shops asking customers to wear masks can increase compliance. take all commands from the tower. And in April 2020, before his sweeping facial coverings mandate, Governor Northam even went to a prison and told the prisoners that you can even grab a bandana. And quite a few people, even outside of prison, actually did that. And maybe you are one, perhaps. And not all of them would be described as regular worshipers or persons of deep religious faith. Many of them might even describe religion as the opiate of the masses, only for the less educated, and certainly those who had never attended college to become enlightened, and perhaps even woke, as is the Sherman vote. And now, with 75.2% of adults who have received at least the first dose of the COVID-19 vaccines, a good question to pose to our highly educated, especially those who reject religion on intellectual grounds, is how many had accepted on faith the declaration of Ralph Northam when he told you that even a bandana would help to prevent an infection from COVID-19. A proposition from which even the New York Times had to run away. By June 2020, Pew Research reported that 65% of U.S. adults say that they have personally worn a mask in stores or other businesses all or most of the time in the past month. Why not? It was required. While 15% say they did this some of the time. So we had some people going in non-compliant. Relatively, some small shares of adults say they hardly ever, 9%, or never, 7%, wore a mask in the past month. And 4% say they have not gone to these types of places. Yet, by June 2020, also reporters at the Washington Post had stated 4 months of discord about the coronavirus epidemic kept transforming the cloth mask into a potent political symbol, touted by Democrats as a key part of communal responsibility, labeled by some GOP leaders as a sign of government overreach and as a scarlet letter penned on the weak. And that seemed to acknowledge that even in a public health crisis, where today over 40 million Americans have been infected and almost 650,000 have died, some people were not really using the science as much as their politics. And in June 2020, Pew Research had found that Americans in counties with more reported deaths from the coronavirus when adjusted for population are much more likely to say they wore a mask all or most of the time in stores or other businesses in the past month than those in counties where the death rate can be classified as more moderate or low, 80% in high-impact counties, compared with 67% in medium and 55% in low-impact counties. And if mask wearing was supposed to prevent infections, one may have conceivably thought that if there was more compliant behavior wearing masks, actually facial coverings because masks are medical grade, there should not have been more reported fatalities, using the science, as they say. But things just didn't quite work that way. Understandably, 2020 was a big presidential election year for many of us, even finding Virginia Congressman Don Beyer telling his supporters that it was the most important election of his lifetime. But now, with over 75% of American adults fully vaccinated and almost 650,000 fatalities to COVID-19, can anyone point to any study that had empirically validated the conclusion that non-medical grade facial coverings were actually effective at preventing infection? Even a preacher can say anything in a pulpit. So this is not a question about what Governor Northam said or Anthony Fauci said, but rather a simple common sense question, like the common sense measures adopted by the governor. For our newfound faith, is there any science or empirical evidence to validate the proposition that even one-ply cotton, like a bandana, was impervious to microbial penetration? Nanoparticles measured in micron units that may even be bigger than your God and mustard seed of faith that you say can move a mountain. Well, in your pandemic crisis, where many were hoarding toilet paper, throwing face shields on children, closing businesses, churches, libraries, and schools, and masking up, we decided to submit a FOIA request to the governor and Virginia Department of Health to ask that stupid question of showing us the science. And the only responsive documents that we received were two non-peer reviewed research papers advocating the use of the UNESCO precautionary principle as a key consideration in developing policy around use of non-medical grade masks in public. And according to Governor Northam's research, UNESCO states that when human activity may lead to morally unacceptable harm that is scientifically plausible but uncertain, actions shall be taken to avoid or diminish that harm. But not for two problems that may be good enough for your faith. One, it doesn't establish that your bandana or K95 or scarf or whatever will prevent you from actually being infected. And of a special importance when you have a case that has reached the pinnacle of the achievement of arriving at the United States Supreme Court, it is concerning that the UNESCO precautionary principle has actually been rejected by American courts. And if you need to fact check Wikipedia, the unprofessional source upon which one of Northam's researchers had relied for a citation, dear God, you can find that even Wikipedia can direct you to an exact case that rejects the precautionary principle, albeit providing the wrong citation for that case. So you may have a little problem finding it on Westlaw. And oh ye of little faith, at least religious, that's about all the time that we have for now. And if your faith has managed to help you survive this long, you can surely wait for the next installment in this series to learn what we know as intelligence professionals about the actual effectiveness of your non-medical grade facial covering for purposes of preventing an infection from a pathogen or biological agent that may have been zoonotically evolved or may have found its origins or genesis, as we say, in a laboratory. Live long and perspire, Star Voyagers. This briefing is unclassified, as you were. My name is Major Mike Webb, and by God, I am running for Arlington Public School Board. Let's keep Mike Webb away from our schools. Honest. Carry on. This advertisement was authorized by Mike Webb.
I used to be a Power Ranger in a former life.
Thunk, I could have had a vaccine.